The octuplet mother story has prompted debates about fertility treatment.
Some states, including Missouri, could pass laws limiting the number of embryos a mother can carry. News Channel 5's Jasmine Huda has more from the Information Center. Good morning, Jasmine.
Good morning, Jennifer. Well, this has become a big issue in the past few weeks, raising questions about ethics and constitutional rights. Many people are familiar with Nadia Solomon, who gave birth to octuplets after having fertility treatments. And that was considered an extreme case of in vitro fertilization, where critics say far too many embryos were transferred. A Missouri bill would use guidelines from the American Society for Reproductive Medicine. It would include a recommended number of embryos that could be implanted that would be based on the woman's age and the chances of her having a successful pregnancy. Dr. Sherman Silber is with the Infertility Center of St. Louis. He said in vitro fertilization is safe, but in many cases, he said patients should have limitations.
They're putting themselves at great risk, and the chance of losing all the babies or having disabilities or serious problems, they just don't face up to that because they only have enough money for one cycle.
On average, women can pay up to $15,000 for each fertility cycle. Now, critics say a measure like this one would place unfair limitations on patients, especially older women who are desperately trying to get pregnant. This bill was heard earlier this week. It was introduced by State Representative Rob Schaaf, a Republican from St. Joseph. The state of Georgia is considering a bill that would be even more restrictive. Art and Jennifer?
Thanks, Jasmine.
Fertility treatments have become a hot topic around the country following the octuplet mom case out of California.
As News Channel 5's Jasmine Huda reports, Missouri could pass a law on embryo transfers. Jasmine?
Well, Jennifer, lawmakers want to prevent another case like the one involving Nadia Solomon. Solomon turned to in vitro fertilization and ended up giving birth to octuplets in January. Critics say doctors need to keep down the risk of multiple births like Solomon's by limiting the number of embryos that are implanted. The Missouri bill would use guidelines from the American Society for Reproductive Medicine. It calls for no more than 2 embryos for women under 35 years old and no more than 5 embryos for women who are over 40. Dr. Sherman Silber of the Infertility Center of St. Louis said the issue of placing limitations is controversial, but he said all sides should be able to agree on one thing.
But what isn't debatable and what isn't an ethical debate is we have to prevent multiple pregnancies because they're not safe, and we can do it with some very, very simple laws.
Silber said in almost all cases, in vitro fertilization is not covered by insurance companies. He said that should change, that it's the insurance companies who should place limitations on embryonic transfers. More on that coming up at 6. Jennifer?
Thanks, Jasmine. Ever since a woman from California gave birth to octuplets, the issue of fertility treatments has become a hot-button issue. Some states, including Missouri, could limit the number of embryos a woman can carry. News Channel 5's Jasmine Huda joins us from the Information Center with more on this story. Jasmine?
Well, Jennifer, some may call it knee-jerk legislation. Others will say it's needed to prevent another case like the one involving Nadia Solomon. The 33-year-old single mother of now 14 children underwent in vitro fertilization. Many people have been outraged, saying far too many embryos were transferred. Under a Missouri bill, doctors could only implant embryos based on a woman's age and the chances of her having a successful pregnancy. Now, in most cases, insurance does not cover in vitro fertilization, which can run as high as $15,000 per treatment cycle. Some doctors, including Dr. Sherman Silber with the Infertility Center of St. Louis, says if that were to change, it could prevent patients from having multiple births.
They put pressure on physicians to transfer too many embryos and do the wrong things. Insurance companies, if they covered IVF, then they could say transfer only 1 or 2 embryos. They can, and otherwise we don't cover it. And that's such a simple solution to the problem.
And there are many sides to this issue of in vitro fertilization. It raises questions about ethics and constitutional rights. This bill was heard earlier this week. It was introduced by State Representative Rob Schaaf from St. Joseph. A similar bill is being considered in Georgia, but it is expected to fail this session. Art and Jennifer?
Thanks, Jasmine. Women experiencing infertility problems could be affected by what's being dubbed the Octomom bill in Missouri.
If the measure becomes law, it would restrict the number of embryos a woman can carry. News Channel 5's Jasmine Huda joins us from the Information Center. Jasmine?
Well, Art and Jennifer, Missouri and Georgia are both considering measures in response to the octuplet controversy out of California. Nadia Silberman gave birth to octuplets after undergoing fertility treatments. In her case of in vitro fertilization, critics say too many embryos were transferred. Now, a Missouri bill would include a recommended number of embryos that could be implanted, and that would be based on the woman's age and the chances of her having a successful pregnancy. Critics say the measure places unfair limitations on patients, especially older women who have difficulty getting pregnant. It can cost up to $15,000 per fertility cycle. On the other hand, supporters say the measure would reduce the number of unused embryos.
Everybody's going to be fighting with each other and tearing each other's eyes out because they have such strong disagreements and anger and fear. But what isn't debatable and what isn't an ethical debate is we have to prevent multiple pregnancies because they're not safe, and we can do it with some very, very simple laws.
Most insurance companies don't cover in vitro fertilization, and Dr. Silber, who you just heard, says that should change because the insurance companies can limit the number of embryos that are transferred. Now, this bill was up for a hearing earlier this week in Jefferson City. Art?